So Dilip, it is all yours. I want to take a moment to introduce Dr. Dilip Sarkar. He is an international speaker and is considered an authority in yoga. He has been involved in yoga for now many years. And the real part of it is the transformation of his personal life. So he used to be the president of the International Association of Yoga Therapists, and as well as the chair of Life in Yoga Institute, and is right now a serving member of the board. But the part is, I will leave it. He is also involved in many organizations and is a high-profile individual. I will leave now Dr. Sarkar to take it away from here and speak further.
Okay, thank you. All the technological details. You put me on a spotlight for all. I'm in the spotlight, Rajan.
Actually, yes, you are in the spotlight because anybody who is the speaker, it automatically goes into spotlight. Okay. The one thing, of course, is I'm going to take a moment to explain how each speaker can be most effective in utilizing this forum. So whatever PowerPoint presentation you have, first open it up now in your computer. And once you have opened it up, you're not in presentation mode. You've only opened it like almost in editing mode. So once you have opened the PowerPoint presentation, after that, go to the share screen, which will be towards the bottom of your screen. If you click on share screen, it will you will see it automatically selects your entire screen. So you press the share button, which is on the bottom right-hand corner. And once you have selected the share button, whatever is on your screen will come up onto and be shared with everyone. At that point in time, you can take the PowerPoint into presentation mode. And if you stay in the same screen for too long, then in which case sometimes it may freeze in that mode. And some people prefer to actually staying without the presentation mode, scrolling from screen to screen. But as long as you're moving fast, Dr. Sarkar has like 100 and odd slides over there. He'll move pretty fast. So for you to move on presentation mode will be quite convenient. So with that, Dilip, please go ahead.
Yeah, okay. Thank you, Rajan. You hear me good? Hear me okay?
All good.
You see me good? Okay.
Yes, all good.
Thank you, Sadbir. We've been here years and years together. And Sadbir will tell you all about the research. He's from Harvard, but you will see me from the practice. We have a tremendous number of patients who got better and who are off medication, disease-free, enjoying a quality life. And I just did a presentation this morning, the practice, how to integrate yoga therapy with the Western medicine. If you have joined, you have seen me. Now, I see all the people, most of them I know by now. We have one surprise. I want him also to speak for 30 seconds. He is the first certified yoga therapist from Bangladesh. He is joining from Bangladesh. It's a Kushal Rai. Can you unmute yourself and introduce?
He has already introduced himself.
He can unmute. All right, Kushal, say a few lines about yourself.
Yes, sir. Namaskar, everyone. I'm Kushal Joy from Bangladesh as a yoga therapist, and my master's was yoga therapy from Svasa Yoga University, Bangalore, and I work a yoga teacher Indian High Commission in Dhaka, and practice yoga and follow Dilip sir and all of you, Sadbir sir, especially Dilip sir.
Dilip, he introduced himself earlier. You came late.
Oh, he did. Okay. I'm sorry. But one thing I just want to tell you, he did his master's from SBSA. So Okay, without further delay, let me go ahead and share my slides with you. And I don't have any sound here, so I can share here. And I can go to the, okay. You guys see all?
All good, carry on.
Okay, so we are all talking from the practice situation. So the title of the talk is called Place of Yoga in Medicine. Basically, how to show you how to integrate yoga therapy with the Western medicine. And first, I'm going to show you some evidences, okay? So before you all know, I'm going to go quickly, a few slides, which we keep it for all of you, is that, and you'll be hearing more and more every day. This is obviously our disclosure that this tells you everything. Our Western trained physician sitting in a lotus pose. And yoga, you will see, Rajan is going to talk about it today and tomorrow, and you'll be hearing it. As I said, at the end of our courses, your name will be either yoga or a pranayama. You know that very well. But most important way to think about it is that if you think from your computer and Western medical perspective, a body is a hardware, mind is a software, and spirit is a program. That's our existence. And yoga, practice of yoga basically is a fixing of software. And who is fixing our software? The programmer, which is basically I. I'm going to fix my software. And it's exactly like what Rajan is going to talk to you more and more. You'll see it's like we get the software updates. I get an Apple Watch, I have an iPhone, I get the software updates. And exactly the yoga practice is correcting the software, correcting our mind, so hardware gets fixed. But we also, as yoga therapists, do both of them. We fix both the hardware and the software. It's a philosophy, 196 sutras, out of which 193s are to quiet down your mind. The physical sutra is exactly what is most fundamental, as your therapy is your sthiram sukhamasana, stillness, happiness, and asana. And that's what brings you to this, the 8 limb practices, which Rajan will go through in details tomorrow. Basically, yama, social restraint, personal restraint. Asana is basically internal and external alignment. Pranayama is a voluntary regulated breathing. Pratyahara is a control of senses. Dharan, focusing your mind. Meditation is between controlling your thought process, expanding your gap. Samadhi is a union of your body, mind, and spirit. What you do is yoga therapy. Primary definition of yoga therapy is an adaptation of these practices based on the patient's or client's clinical condition. Based on the clinical condition, we pick and choose. Remember, we're not using anything extra. We're using same philosophy, same practices, but we learn how to use them. Particular patient, that's what our training is so long. Yoga teacher's training is only 200 hours, and yoga therapist training is some 800 to 1500 hours. And there is a reason for it. Essentially, the outcome of yoga therapy is a relaxation response, and it's an activation of parasympathetic tone. But understand the whole relaxation response. Even you will see the book written by Herbert Benson about relaxation response in 1969 is nothing but a meditation. I think at the time he was really not comfortable using the word meditation, use the term relaxation response. And we see when you do practice, we practice with our health tracker. We have Apple Watch. I can watching my heart rate, watching blood pressure, watching my EKG, and you can see the whole physiological effect of relaxation response. And essentially, which me and Rajan always talk about it, we see I get a saliva in my mouth. Saliva in your mouth is a parasympathetic activation. So because your salivary glands, the whole GI tract, starting from your parotid gland to your anal sphincter, supplied by parasympathetic nerve, which is called a craniosacral outflow. And thoracolumbar outflow is your thoracic. Sorry, sympathetic. So if it's sympathetic, what happens? You get dry mouth. So for a physicians, this is not too complicated, but you'll understand how we can integrate this relaxation response and activation of parasympathetic tone. Let's come for a cardiovascular disease. In a good pranayama practice, what happens, lung is like a balloon. We have a 6-liter capacity. We have a 1.5 liter to keep the lung open. We have a 4.5 liter for your vital capacity. Normally, we breathe only 0.5 liter, or 0.5 liter, 500 cc. So when you learn how to do your better voluntary regulated breathing, you breathe out longer than breathing in. Effortlessly, you can take in, breathe out. The moment you breathe out, intrathoracic pressure started to come down. You get a negative intrathoracic pressure. What happened, the venous return from the inferior vena cava and superior vena cava increases, so you have a better preload for your heart. Increasing preload. And with the relaxation response, you reduce the afterload. That means you relax your peripheral blood vessels, relax your peripheral resistance, and increasing preload and decreasing afterload increases your ejection fraction. Ejection fraction of the heart is a function, and think about it. There is no pharmaceutical product today which can do this two combination at the same time, increasing preload for the heart and reducing afterload. Just giving an example, because we did the whole course, yoga therapy for cardiovascular disease. We have a cardiologist came in, and after my presentation, after our presentation, they were so surprised that what is the effect of this yoga therapy on the cardiovascular system. This is a beautiful slide I use all the time. The moment you keep on practicing yoga, you get a total transformation. The transformation is, we say, from your caterpillar to the butterfly. That means once it transforms, there is no point you can come back. What happens, it is a phenomenon called neuroplasticity. Like, suppose you're going to touch your toes, you cannot do it, but you stay in the pose. Stay in the pose a little longer, especially incorporating your breath, breathing out longer than breathing in. Slowly and slowly, you'll see a neuroplasticity will set in. It will allow you to go down a little more. And suddenly one day when you touch your toe, what will happen to you, suddenly you realize, something is happening to me. What is happening? Now let me see what I'm eating. Let me see what is my sleep pattern. Let me see what is my bowel movement. Let me see what is my elimination. So we say there is no problem in the world which does not have a solution. And there is no disease in the world which does not have a cure. Just awaken the doctor within. And awaken the doctor within is basically, it's your practice. I see so many patients comes to me. I said in my class, I don't want to do it. My doctor is telling me this. I said, great. Why didn't you talk to your doctor? He says, the doctor within you. Doctor within you will tell you the moment you do the asana practice, you start with the asana practice without any pain. The moment you get into the pain in asana practice, you create imbalance in the physical body. Then we'll see, Rajan will show you a little bit more, Annamaya Kosha to Pranomaya Kosha. Any imbalance you create in a physical body shows up in your breath. So you follow your breath. Breath is completely effortless. Breath is completely as ease. You have completely your pain-free asanas. You progress rapidly. We must make our body work for us. This is a fundamental principle of yoga therapy. Nothing has the greatest power to heal but the self. And finally, the last statement, as I say, not in my transformation, every patient transformation, we call very interesting. We call transition to transformation. They're saying, I am the cause and I am the cure. So Hippocrates, the father of our modern medicine, say, it's important to know what sort of person a disease has and what sort of disease a person has. Yoga therapy is totally holistic. It is totally not a reductionist at all. And we now understand very well that unless you understand a Ayurvedic philosophy, Ayurvedic concept of body type, Vata, Pitta, and Kapha, you will no way you will understand yoga therapy. You will understand, no question about it. We have a Western model, an Ayurvedic model, but once you understand the Ayurvedic model, yoga therapy becomes absolutely clear to you. We connect all the dots, and it is saying we'll come to essentially, after a global practice, we call it reductionist practice, and we have a beautiful term. We call it a reductionist holism. We'll show you what to do for diabetes, but in a holistic way. And it is a part of a new medicine, part of medicine called integrative medicine in the United States. About 15 years back, maybe 3 out of 125 medical school had it. Today, almost 100 medical school has, 65 has a clinical clerkship, 25 have a training program, and 2014 we established the American Board of Integrative Medicine. What is very interesting is the Economic Consortium for Integrative Medicine and Health, which our Sadhbir is very active in that. They have developed a definition of integrative medicine, and look at where the yoga therapy stands. It is a relationship between a practitioner and the patient, focuses on the whole person, looking beyond the body in mind to achieve optimal health and healing. There cannot be any better definition than yoga therapy, which is coming from the Consortium of Integrative Medicine and Health. And as Sadhbir was telling you, this is becoming a part of our Western medicine. We really don't need too many proof anymore. It is, the Western medicine is called evidence-based medicine. Show me, give me the number. Sadhbir is going to show you all the numbers, all the figures, all the journals, everything. But it is a practice-based evidence. Unless you practice, all the physician comes to me and said, "Oh, I want to incorporate it in my practice." I said, very simple. So what? You start practicing. You start practicing, you feel within yourself, and physicians have a good advantage is that they can feel the physiological changes. When they're doing the Bastrika Pranayama, they know the physiological changes, what hyperventilation syndrome is doing. Or whether they're doing a breath holding, they're doing a hypercapnia, what is your CO2 narcosis is doing. It's very important. So practice-based evidence. So our physicians who really didn't trust us anymore, so we don't need to show any more evidence. This is a positive proof of global warming. It is an experiential, very, very important concept of yoga therapy, that you are the creator of your destiny. I can tell you everything, all this stuff, but you have to do it on yourself. It's a transcendental science. It is a beyond science. So many of part is a philosophy, which is experiential, and science may not be able to explain it. And it's a very experimental, means it's a personal practice. Everybody has their own practice, and we feel very comfortable, and that is creating our therapeutic changes. So basically, yoga therapy in Western medicine is a lifestyle. It is an art and science of healthy living, and it is providing health. If you do practicing, it will do two things. First, it will create what is called your treatment of a disease. Disease will get treated, no question about it. You will see articles after article. If you put in the PubMed today, you will get over 6,000 articles. And then it creates what is called a maintenance of health. Shastha Rokha, Roger Chikitsa, treatment of disease, and Shastha Rokha. This maintenance of health is always a preventive medicine. So yoga therapy is called a preventive medicine. Let's see, we like to see this, that the time is coming. Doctor is going to write a prescription, yoga therapy for chronic low back pain, metabolic syndrome, cancer. The evidence we see today, we have a Dean Ornish, many of you know, he wrote the book called Reversal of the Coronary Disease. And he was trained here in Yogaville to Swami Satchidanand, and he's on intensive cardiac rehabilitation, and is covered by Medicare and many health insurances. And I have a program in my medical school also, Dean Ornish's program. Remember, it's a transformation, not a transition. Transition is short-lived. Like you do a Vajrasana, you do a Bandukasana, you do a Kapalbhati Pranayama in the morning session. Even in my class, a patient will leave and say, my blood sugar has come down. I can see my blood pressure is down. You know, I'm meditation, I'm feeling my capillary pulse. These are all transition. But transformation is not to master the posture, but use the posture in stages for transformation and therapeutic benefits. You'll see every posture has all different the body's alignment. It is a practice, it meets where you are. A staged approach that teaches, that's what we taught this morning, that how do you start sitting in a chair, keeping your spine straight, eyes closed, incorporating your breath, incorporating your mudras, which we'll do today. It's a pain-free. The moment you have a pain, it is not a therapeutic yoga. Effortless pranayama. Effort pranayama means you are doing a pranayama in stages, impossible become possible. Pranayama as if it's a normal breathing. There is no effort in it. It builds physical and mental resilience. Basically, it unblocks your body's own healing power. As I said, it's a relaxation response, and all the physicians asked me yesterday, even two weeks back, a renowned physician called me, asked me what a relaxation response. Relaxation response means I'm able to sit down first with my knees high up. This is an easy pose, but I'm comfortable. I have a little bit of a discomfort, comfortable discomfort. Stay in the posture, eyes closed, breathing out longer than breathing in. Slowly I'll be able to go into, it's called a perfect pose of Siddhasana. Takes about 20, 30, 40 inputs in the brain to create that you call a neuroplasticity. So from there, I will be able to get up in the one foot in my top, which will be called a half lotus. I'll be able to get into a full lotus. It is in the time frame. Like even I did the morning session. I got a little note from Mrs. Mahajan, she's a physician in Houston. She says, wow, what a wonderful flexible body. It is not my flexible body. It is, I was like a stick. I was a surgeon. I was operating like this, but it is this my practice which gives me a relaxation response. Then I practice every day. That's what creating it. And primarily, we're totally convinced this relaxation response is a preventive medicine. No question about it. Remember, all our lifestyle-related disorders, it starts from your stress. Stress is a sympathetic overdrive. It causes high cortisol. Cortisol converts your glucose into your omental fat. Omental fat is inside. The omental fat then secretes your inflammatory molecule, which causes diabetes, hypertension, atherosclerosis, and dyslipidemia or high cholesterol. So these are all together called your metabolic syndrome. It is not the risk factors anymore. Today is a diabetes, tomorrow you'll have hypertension. Today have hypertension, tomorrow you'll have coronary artery disease. And all of them comes from the two fundamental cause in our life called insomnia and sleep apnea. Remember, sleep apnea and insomnia is a root cause of our truncal obesity and metabolic syndrome. So it's a wonderful practice. The evidence we see in this country was the Swami Rama. What happens to them, these yogis, and I can see it even is happening to myself slowly and slowly, by continuously practicing the activation of the relaxation response, which is a parasympathetic activation, they're able to control their autonomic nervous system. Here he comes, he says, I can stop my heart. Connecting up, can stop his heart. He has his two blood supply from his radial and ulnar artery. And the whole study is showing that slowly and slowly, this is actually, he's a professor of physiology, Bikar Anand from All India Institute. The first person who really observed in the United States was Dr. Herbert Benson. He was actually joining your transcendental meditation, Maharishi Mahesh Yogi. And at the time he found at the level of meditation, you get a lot of physiological changes in the body. So like a good American, he came and wrote a book called The Relaxation Response. And that's what I was going to show it to you. And the whole book, if you read that, is nothing but a physiological effect of meditation. So I talked to it since, I think Sadhbir one time, as I said, probably he was not comfortable using the word meditation at 1969, at the time when he wrote the book. He kept on publishing. He kept on publishing. This was one of his another fun, beautiful publication. It's the physiological effect of relaxation response. You know, you can see, Sadhguru is going to show it to you all tomorrow, so I don't have to go too much. It's a relaxation response. You know, it will be your genetic, say, we call it a genetic changes. Say, genetic changes doesn't cause a disease. What it causes is a genetic expression. Gene has to express. And it's called epigenetics. And yoga therapy practice is shown to suppress your genetic expression. Now it acts as a telomere length. I'll come and show it to you. You'll see all the medical terms we're going to use more and more. But see, this is his fundamental, your publication. Essentially ended up, this is probably his one of the final publication, and nothing can be more. This is the Bible of Medicine, New England Journal of Medicine, in April 9/20. This is last year, 2020, the New England Journal of Medicine. The title was The New Era for Mind-Body Medicine. This is Herbert Benson's article. So we have come. I'm going to show you it here. Once we have a presence in the New England Journal of Medicine, we are here. We are here to stay. This is just a little bit of statistics. You know, it just varies. 2016, 36.7 million Americans doing yoga, $16 billion industry. But I'm going to show it to you what is the implication in the medical profession. See, here it is. When we look at it, if we look at a PubMed, if you just simply put a yoga therapy in the PubMed, over 6,000 articles will show up. If you look at NIH funding, clinical trial, about 500 fundings are done. But they have very clear difference of meditation and the yoga therapy, which actually is not a separation. Meditation is the seventh limb. But the moment you put meditation, you'll get another 7,000 articles. So altogether, you'll get 13,000 articles. There are about 450 studies being funded by the NIH. So the first thing we can always trace back in our present day established clinical medical journal. Say, we as a physician, we have a very hard time pushing any of the research article to our clinical physician. But we have no problem presenting with established clinical journal. So I'm going to show you some articles about the established medical journal so that as a physician or as a healthcare provider, so at least Western healthcare provider, this is a 1973 a Lancet, cannot be any better medical journal. This was a yoga and feedback in the management of hypertension, showing that the relaxation response reduces your peripheral resistance and the blood pressure comes down. It goes to 1975, same article, same journal, Lancet, same author, showing that the blood pressure started to come down in a randomized controlled trial. I'm not going through all the studies because Sadhbir is going to go through all the studies a little later. I'm going to give you a little flavor how it is getting incorporated in our Western medical system. First landmark article came up. This came up from the SBIASA, where we talk about Kushal got his master's degree, one of the best yoga universities today. It's a Nagendra, published as a British Medical Journal, 1985, Yoga for Bronchial Asthma Control Study. Next, I see around 1998, JAMA, Journal of American Medical Association, published the article, Yoga Therapy for a Carpal Tunnel Syndrome. This is the article came up in the Annals of Internal Medicine, comparing the yoga. This is for the yoga for the back pain. And the author, author was actually after that, she had been interviewed by every known media, by ABC, CBS, NBC. It really stirred the whole medical community. And look at that article, Annals of Internal Medicine. Cannot have any better journal than this. This is spine, yoga therapy for chronic low back pain, showing studies after studies how effective it is for the back pain. But what I'm showing it to you, that integrating that this is the most prestigious Western medical journal, which is being accepted by the Western trained physicians. They don't like many of the small research journals because they say the research is the research, but there is a clinical journal. Think of it. You say, Archives of Internal Medicine. I'm showing you these articles is a very, very important because these are all established clinical journals. Yoga for clinical low back pain. Look at that, JACC, Journal of American College of Cardiology. Yoga therapy with atrial fibrillation. When you look at the article, actually, when you look at this article, and we as a clinical physician, we see these articles are probably what we used to write 40 years back. It is not a very good art, but Journal of American College of Cardiology published this article. That is more important. Journal of American Heart Association. Can you imagine of that? They put down a meditation and cardiovascular risk reduction, a scientific statement from the American Heart Association. This was the Journal of the American College of Cardiology is another one. This was a very famous article. Actually, I think Sadhbir will go to discuss with you a lot more. It came out last year. It's a yoga-based cardiac rehabilitation after acute myocardial infarction. It is from the multiple centers, but he will describe more to you just to show you that what are the types of quality of the articles and the quality of journal. This is the first one of the grant from National Cancer Institute. It's given to MD Anderson Hospital. This is your Lorenzo Cohen. He wrote the book with the Sadhbir Khalsa and Charlie Tellis, four of the authors, and I will show you the book also. They got a grant for yoga therapy for breast cancer. They went back again to their protocol, took it to the SVIASA at the collaboration of the SVIASA and MD Anderson. They published a paper in the Journal of Clinical Oncology on the yoga therapy in the breast cancer. And that's just very interesting. A little time before, there was another article on yoga therapy for breast cancer on the Journal of Clinical Oncology. Very famous article. And this is the one, something I find it out one time in Archives of Internal Medicine. It just struck me. It said, when conventional medical providers recommend unconventional medicine, they went for the data after data, how many physicians are really prescribing the so-called, we call it a non-conventional, but now it is not, now it is called integrative medicine. Remember the names we have gone through. Alternative medicine, it says no, nothing is alternate. Complementary medicine, no, it's not complementary anymore, So what is it? Integrative. What is integrative? Integration of the science of modern medicine with the wisdom of traditional system of healing. Very important. This is a very, very powerful article. This is a functional MRI and showing the Om chanting. And this is from the Gangadhar's paper. This is from Nimhans, very famous institute in India. They're showing that your brain has a frequency, and when you create a frequency, either with the sound of Om or with the Brahmari Pranayam, bumblebee, the two frequency cancel, interact. It's like a harmonic resonance. And it really quiets down the brain function and activity. University of Virginia has started a program called the Foundation of Medical Yoga for the Healthcare Professional. I was instrumental to starting the program. I taught all the teachers who were teaching it. In fact, all the teachers also came through this CME course before they started the program. This is the first yoga university outside India. This is just started in Los Angeles. This is actually an outshoot of SVIASA from India. It's called LIYI, Vivekananda Yoga University. And we are all presenting for them. They started the first master's course in the yoga. And supposed to be, the physical presence in Los Angeles, but pandemic hit. So they all became online. They're finishing almost a year now, starting the second year. And I'm going to present a same topic, integrating yoga therapy with the Western medicine. It will be June 5th, we're presenting for them. Yoga therapy for healthcare delivery system, a newest medical school, like this is the one, we call it a, I was there, and actually I was trained in Pontiac, Michigan, very close, called Oakland University, Beaumont Hospital, and there is called a Beaumont School of Yoga Therapy with a full-time yoga therapist. And I went to the department, the medical students and the residents comes and rotate, and it is a part of the clinical rotation. I had a fellow in Cleveland Clinic. Cleveland Clinic has a powerful yoga therapy department, and one of the fellows are rotating through a part of the yoga therapy program. This is Master of Science in Yoga Therapy. This is called Maryland University of Integrative Health, which they've been started in 2013. And interesting, every graduate who comes out from there, they gets a job right away. This is a program, very good friend of mine is Larry Payne. He started a program in Los Angeles called Loyola Marymount University, and all of the yoga therapist student rotates through a family practice clinic. It's called Venice Family Practice Clinic. They all put their white clothes and they look like all physicians. So let's take a look a little bit for the physician, how the yoga therapy works. We call it a psychoneuroendocrinology. What does psychoneuroendocrinology means? That when you establish the yoga therapy, you establish a relaxation response, it affects your limbic system. Remember, limbic system, which is beyond your motor and sensory cortex. This is your amygdala and hippocampus. Amygdala responds to fear, hippocampus to your memory. It sends a signal to your homeostasis called hypothalamus. Hypothalamus sends a signal to your autonomic nervous system and to the pituitary gland, which so pituitary adrenal axis. It causes what is called a altered hormonal homeostasis. All the hormonal changes which have due to our lifestyle changes, it gets balanced with this. And also it shifts from sympathetic to a parasympathetic very quickly. We also call psychoneuroimmunology because it also affects the immune system. It controls epigenetics. We'll talk about more and more, you will know. Gene expression suppresses all the genetic expression, and it acts like an antioxidant. It controls apoptosis, the telomere length. We got a Nobel Prize for this, Nobel Prize for that, and better immune status due to prolonged lifespan of the lymphocytes. And these are all being researched and diagnosed and very clear. And you can see in the pranayama, as I said in the before, the inhalation is sympathetic and exhalation is parasympathetic. The mechanism and essence of yoga therapy, aerobic glycolysis. When you learn how to remove the carbon dioxide and bring the oxygen back in, oxygen combines with glucose from carbon dioxide, water, and ATP. Adenosine triphosphate, adenosine is energy. Energy becomes catabolic, metabolic, anabolic. You'll see catabolic is called vata, metabolic is called pitta, anabolic is called kapha. Don't have enough oxygen, called anaerobic glycolysis. Glucose with less oxygen forms a lactic acid, pyruvic acid, pain-producing substance that is the creator of all underlying chronic diseases what we have. Increases vagal tone, it modulates autonomic nervous system, causes a rapid shift from sympathetic to parasympathetic. And most important is they learn how to control our autonomic nervous system. When you put your head down below your heart, the pressure inside the brain goes high up, pressure inside the eyes goes high up, pressure inside the neck goes high up, and slowly what happens? You start doing an adaptation. Baroreceptor sensitivity goes high up, and it improves the cardiovascular fitness. It improves the heart rate variability. You can see same heart rate, 49. This is a parasympathetic, no heart rate variability, sympathetic function. So it's a primary prevention. That means a person who has a genetic predisposition creates a relaxation response. It causes a genetic suppression called primary prevention, prevent onset of the disease. You can see, this is the Cleveland Clinic who has a program called Lifestyle 180 program. This is the Time magazine, you see how not to end up. And they have the program They have their about 10 programs now, daily yoga program, your meditation program. And this is very interesting. The first is called a Chief Wellness Officer. This is with the Dr. Oz, and he wrote the book with him. Secondary prevention means you have a genetic predisposition, the lifestyle, you got the disease. You got either breast cancer, you got a heart disease, and you get the angioplasty, bypass, or you get a radiation therapy, chemotherapy. But when you incorporate the relaxation response in yoga therapy, you get a genetic suppression, you prevent the progression or even reverse the disease process. As Rajan was telling, it happened to me, and I'll show you a little bit more when we discuss the cases tomorrow. Tertiary prevention, we're saying that prevents the complications. Like for diabetes, we have a diabetic retinopathy, diabetic nephropathy, all the diabetic complication. That's why we incorporate yoga therapy in Western medicine. It's a powerful rehabilitation. It's a better management of the disease, less pharmaceutical support, better quality of life. Can't be anything better than this. I'm going to you little bit of just give you an overview, because you'll be hearing this thing a lot more in detail throughout the next 2 days. It's just overview. I'm showing it to you where you stand. And many a time we ends up in a queue. This is the book. I wrote a book called Yoga Therapy, Ayurveda and Western Medicine. It's called a Healthy Convergence. And it has all how to integrate yoga therapy with the Western medicine. This is the book for our friend, Yoga as a Medicine, Meditation, just to show you what are the resources we have today. This is the book Larry Payne wrote, Yoga Therapy and Integrative Medicine. Actually, your Dr. Dean Ornish and myself, this is myself, who wrote the foreword for this book for Larry Payne. This is the book you'll see. Sadhbir is going to talk to you a little bit more. Principal, and this is for actually healthcare provider. Sadhbir, Lorenzo Cohen, Timothy McCall, and Shirley Tellis wrote the book. Shirley Tellis wrote this book, Research-Based Perspective on the Psychophysiology of Yoga, and she wrote that this is the new one. She just came up. You will hear about Shirley Tellis more and more. She's the #1 yoga therapy researcher, and you will see a lot of the reference when you hear about the researches. This is one of the DVDs, one of my DVDs. I just and this is primary for your healthcare providers. A recent DVD called Yoga Therapy for Health and Healing, a Daily Practice. And all the informations are given as yoga therapy and describing in the Western medical terminologies. First evidence-based, and you'll see Sadhbir will talk about it. It's Dean Ornish showing the reversal of coronary artery disease with yoga. His program called the Spectrum Program, which was being accepted by Medicare and now insurance companies. His new one is called Intensive Cardiac Rehabilitation, and even my medical school also has this. NIH has a NCCA, National Center for Complementary Integrative Health. It used to call NCAM, and it has a whole section of the yoga therapy. And the director obviously is a physician, and you will see more and more, and we'll discuss more and more about this by the time we go by, say how they're helping and supporting our yoga therapy and our conferences like International Association of Yoga Therapists. These are the journal the International Association of Yoga Therapists publishes, the International Journal of Yoga Therapy, which Sadhbir Khalsa is our editor-in-chief, and for the practitioners, which is called the Yoga Therapy Today. And you'll see these are all your peer-reviewed, and IJYT is also in your PubMed index journal. I just said that even in the Harvard Medical School are doing, this was the second international conference on the role of yoga and Ayurveda. Benson Henry Institute, you remember our Herbert Benson, we met him so many times in our conferences, and there, and when you go to Harvard Benson Henry Institute, there's a whole section of yoga and see how to implement yoga in your health care. Few of the patients, I'm going to skip these patients because I'm going to talk about it tomorrow yoga therapy patients, and to how we have incorporated and what is their outcome. Just a little bit of a research, which you'll see, Sadhbir is going to talk to you a little bit more. There is a journal. This is called a Yoga Mimamsa. It came out from your novella for Kaivalladham, and he'll talk to you a little bit more. Started in 1924 and still being used today. Your Swami Ramdev started called University of Patanjali, and he hired Shirley Tellis. Shirley Tellis is one of the world famous researcher, and she started the yoga therapy research in SBIASA, and that was her primary profession at the time. After her PhD from your mental health, she's a physician, and basically this is our whole research institute, Patanjali Research Institute. I visited many times, visited with Shirley Tellis. They have every parameters. You think about yoga, you put in a person in yoga posture, you do all the physiological parameters, and so all the information comes. Like for us, we are also doing it very clearly. We're doing it through the Apple Watch. We're doing through Fitbit, and we are doing it when we're practicing. And we as a physician, we can clearly see the changes, what is happening to our body, physiological changes. There's an evoke potential. You can see the research. And coming back, this research institute, which we also have one here, you will see in the Kripalu, where Sadhbir is there. And Sadhbir will talk all about the research, so you will know a little bit more and more. You have a functional MRI, and we can do the research of the functional MRI, what happens to the yoga. This is another center, which is a very famous center. It's called SBIASA, Swami Vivekananda Yoga Anusandhan Sanstha. It's basically called Yoga Research Foundation. It is in a little outside in a city called Bangalore, India. And very interesting is, if you look at their administrative office building, if you look at the top, that the roof of the building looks like a shape of an O. And this is in their auditorium, and they are providing your bachelor's, master's, Doctor of Science, D.Litt. 2 years back, or maybe 3 now, they offered Sadhbir Khalsa, a Doctor of Science, was honorary, and gave me a Doctor of Letters in yoga. So I got a Doctor of Letters in yoga, and Sadhbir got a Doctor of Science from the same university. It is their research center when they first started there, and Visana, and this is Shirley Tellis and myself. We're in her lab, and this is the hospital in SBIASA. They have the whole hospital called Arogyadham. The whole hospital is treating patients only based on yoga therapy, and also they have their intensive care unit. This is their ICU in the hospital, and this is the cancer center. So they're treating every Western diagnostic diseases in that hospital in an inpatient setting. So I'm going to finish this. I finish these slides to everybody all the time. Like origin of yoga therapy, he said, if you look at it, and if you be like a baby, which we all are after practicing for yoga daily, we all become a baby. The baby is entirely spontaneous. They stand up in a Tadasana mountain pose. They're in the Vrikshasana tree pose. They sit down in the Vajrasana. They sit down Sukhasana. So they must have some changes within them. They feel it. That's why they keep on doing it. And that is the thing we incorporate on a purpose. We get up into Cobra pose, and this is we should practice. We do the back bend on the mat for our chronic low back pain. Salabhasana, Lokasi, to get into the locus. Vajrasana, downward facing dog. The normal. Actually, I'm watching now. My grandson, he sleeps with he gets up with a downward facing dog. He does a cat pose. Jathar Parivartanasana. This is the way we try to do it. and Upavista Konasana. This is the normal. Paschimottanasana, Prasarita Padavuttanasana, Balasana, we do. When you have a really neuropsychiatric disorder, so you do the Balasana. See how simply they can do it so easily. That is the way baby sleeps, Supta Baddha Konasana. And I picked it up and I've been doing it for years and years. And that's how I sleep. And we teach people, if you have insomnia, sleep like a baby. Sleep like a baby. Both pose. And this is the last slide. This is the slide. I got the permission from your Nornish. Actually, it's a slide prepared by our Swami Satchidanand from Yogaville. And Swami Satchidanand, when he was alive, and Yogaville is very close here, not too far, just south of Charlottesville, was invited to University of Virginia. And yeah, this is in presence of hundreds of physicians, wrote it down, illness and wellness. Then he circled I and circled we, said, when you transform I to the we, transform illness to the wellness, that is the outcome of the yoga as a therapy. Thank you again. I'm keeping some time for all of you, almost about 10 minutes, even it started a little late. But I have gone through too fast. I went through too many slides, but it is not that you will be getting all the slides. So you will have all the slides for your documentation. You have the recording, and you'll also get the recording. And then you will be also we'll be discussing this thing continuously all the time. Let me go to speaker view now. Okay.
Dilip, are you staying through Sadhbir's presentation?
I will be a little bit, but I have another program also. You know me, Yeah, as long as I can, I'll try.
The only reason I asked is that obviously the number of things you have presented and what Sadhbir will be presenting together will enable a better way to deal with question answers in the end. But that's why I asked.
My one is just to give a little introduction. I told you, just to show how the Western medicine is accepting yoga therapy, and what Sadhbir is going to go over in details and how to do it. That would be fine. Can you see what are the chat boxes are there, Rajan? I have a hard time reading from here.
Yes. Actually, in the chat boxes, there isn't anything specific to your presentation. Dr. Sushma Mahajan wrote very impressive presentation. And Dr. Naresh Chand said he wanted to sponsor a child to study yoga. Any suggestions? So he has given his email and phone number. Okay. So, well, in this case, if people have any questions, we have the time. So feel free to open up. And after that, I will introduce 2 or 3 special people who have joined us over here after we started. So any question?
Why don't you unmute yourself and ask a question? It will be
Yes.
that answer for you.
So all those who are in the panelist section, you can unmute yourself and ask a question. Those in attendee session, you can write it in the chat box.
And we have been doing it for years and years, and we have a vast experience, and we can share our experience with you.
Actually, Sanjeev Krishna from Dubai is ready to speak. Go ahead.
All right.
Yeah. Thank you, Doctor. It was very wonderful to listen to your details and explanations. In this part of the world, I'm in Dubai at the moment. Here, they treat yoga as just as a sport, even in the government. It's very, very thing to see that how we can inculcate this in this part of the world, because yoga as a therapy, we all know it's beneficial, but still they see yoga as a sport only. But I think we need to initiate or take more interest to see how this can be spread to this part of the world more, not as a sport, but on the beauty of how it can be helping people in all types of therapies. So this is what I just wanted to see, how we can work together to see this part we can initiate this work effectively. So the government also tries to understand the importance, how it has been related in the US, and how we can get it to this side also in the same state of understanding.
Yeah, I can tell you only one thing, as Rajan was saying, and I mean, I don't just speak too loud. I'm like international ambassador for the yoga, and I've been to as many countries you can think about. I was in Dubai. I was in Dubai about 3 times. I presented in Dubai. I presented exactly what I presented here. That yoga is a relaxation response. My last presentation was just a little before pandemic. Dubai has a center called Art of Living. I went to the Art of Living, Sri Ravi Shankar Center. I went there, I did a presentation there. And Dubai has many yoga studios. I was really surprised. And then what I find out, there's few local people came, local women came in the class and joined. So answering to you, yes, it is a sports in Dubai. Government is pushing as a sports, but it is slowly, transformation is also taking place. It is all over the world, same thing is happening. Thanks for sharing from Dubai.
Yeah. In fact, I had a very experience also, because one of my students who was not sleeping for the last 3 months, he had tried all these things to get sleep. In fact, all the other mode of treatment, and his wife was my student. So she recommended and he came. So we have this program that we help people to overcome all these psychosomatic and health issues. He overcame his sleeplessness and he became well. He was a person who was in the media and he wanted to put a board to show that this has helped him apart from all other treatments. So once he put a board, I said, this will be a complicating issue because medical will not accept this. Because he said, it has helped me, why not it help others? He put one board here, one board there. Finally, it became a talk of the issue. And finally, I was landed up with having to pay fines, violation. They're saying, how can yoga help all these things? Yoga is just a sport. Still now the violation is there. We are trying to sort it out. What I'm telling is we have just helped people, and his happiness he has projected to the media because he has this advertisement boards. But now helping him, I am in problem. You understand?
No, but tell you one thing, by presentation. So I can tell you, I've been to Argentina, South American country, 45 million people. By multiple presentation with few other things, they have now 450 yoga studios. That now every book there on yoga therapy, Ayurveda written in Spanish. And it's a very, very popular health. Brazil has incorporated yoga therapy in their called the national healthcare system. But what is interesting in Brazil is that you can offer a traditional system of healing, but there is only catch there. That you have to be a physician, you have a Western trained physician, incorporating yoga therapy. Like they came to my class, when they're talking, I know that they're a very well-trained physician because they're talking about, the inferior vena cava, the blood flow. When they talk, yes, I'm a vascular ultrasound physician. I came to, so just, it's coming. Yeah, we're in Japan, we're in China, things are changing. It will change in Dubai also.
It is coming, of course. In fact, what happened is the Ministry of Economic Department, Ministry of Health Inspection Head, the municipality, all of them came for an inspection to check whether, what am I doing? Am I giving a medicine or things and all? But finally, they found nothing. And in fact, finally, the head of this inspection of Dubai Health Authority became my student. It's all there. But still, the government is still on that idea where they feel this is yoga can only do a sport. This I think we need to work on to really bring this changes or outlook into them. They are accepting it's there. They're all coming up. But still, I feel we need to go a little more ahead on to do something.
So Sanjay, this is an excellent point, but there is one more question on the board from Dr. Kaundi Somne. So before the time runs out, she asks, did Dr. Sarkar mention that Medicaid or medical insurance covers yoga as a form of treatment? Can you elaborate?
Yes. I cannot go in further details on that. This is a CPT code is being established now. And the yoga therapist are working with the CPT code model there. There is a program from the Medicare called a wellness program once a year for one person. They're working on the incorporating yoga therapy in that wellness program CPT code. There are some established CPT code they're using. An International Association of Yoga Therapists is helping them to establish the CPT code. So I cannot give you directly the same CPT code number, but it is being worked out and it is being reimbursed.
So, Sanjeevji, I will have you talk further on this with Dr. Sarkar separately, and I can connect you on this, right?
Thank you.
Thank you, Dr. Sarkar. Actually, let me take you at this break. We have another few minutes. Satbir will begin. But before he begins, let me introduce you to some of our other international, participants here. We have with us, Sanjeev Krishna is, of course, a yoga master who runs this institution in Dubai. And we have Ambassador Idris Odruaga from Burkina Faso in West Africa. And he also leads the entire yoga organizations in West Africa. And he used to be the ambassador from Burkina Faso to India and 8 other South Asian countries. And now he is actively involved with the Burkina Faso government, and he has trained the entire Burkina Faso army's leadership on yoga, where they use that. And he is an advanced yogi himself. And he is both Sanjeev Krishna as well as Ambassador Idris are part of our measured yoga therapy training program. So they work with us in incorporating the yoga therapy advancements that we have done, and they're taking that to their part of the world. So Idrisji, Ambassador, would you like to say hello to everyone? You can unmute yourself and speak up.
Thank you so much. I just want to thank all of you and to thank Dr. Sarkar for his brilliant contribution. Yes, we are trying from West Africa part to give our contribution to a better understanding of yoga. In fact, for the last 30 years, we work very hardly to introduce yoga to the mental disabilities child. This is from where we start really to introduce some small yoga techniques to the small childs who are impacted by mental disabilities. And as Dr. Rajan say, we work also to introduce it to the military headquarters. And today we are involved with the sport department. And we are training now the sport teachers to be at the same time also the yoga teachers. So we are giving course to the sport university to come up also with to give a contribution. So I just want to thank you for all. And it is a privilege for us to join you. Thank you.
Thank you. Thank you for your note.
Yeah.
So now it's time for Satbir to open up. But Dilip, any last words?
Only last word I said, for if you understand a little bit of, Sanskrit or Hindi, I use the word all the time. Kushal will laugh at it to say, Karo yog, raho nirog. Keep doing yoga. I'm guaranteed you will be transforming from called rogi to nirogi to yogi. Rogi means people with disease. Nirogi means people have no disease. Yogi means enjoying a good quality life like us. And Rajan probably will go over with me a little bit. It's 20 years now. I had open heart surgery, triple vessel coronary bypass. Today, for the last 15 years, I'm medication-free, disease-free, enjoying a quality life. Thank you for your help transforming my life.
Thank you.